Nursing is the protection, promotion and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities and populations. Objectives: provision of a caring relationship that facilitates health and healing, attention to the range of human experiences and responses to health and illness within the physical and social environments, integration of objective data with knowledge gained from an appreciation of the patient or group's subjective experience. History. Nurse comes from a Latin word neuter meaning to nourish or to cherish. The word nursing itself is derived from the Latin neuter to nourish. The word nurse has its roots in the Latin noun nutrix, which means nursing mother, often referring to a wet nurse. The French term nurse also referred to a woman who suckled a child. The original meaning of the English word was the same, and the term first used in English in the 13th century, and its spelling underwent many forms: Norris, Neuris or Nurris, to the present. Nurse. Florence Nightingale, aka the Lady with the Lamp, who cared for soldiers in the Crimean War and changed the status of nurses in the 19th century. Florence Nightingale, mother of modern nursing, went to Kaiserswerth for 3 months. On October 21, 1854, left with 38 women for the Crimean War. British casualties were high. Within 6 months, death rate cut in half. Made rounds at night with a lamp. Lady of the Lamp opened the Nightingale School of Nursing in 1860, where she stressed good food, clean air and sanitation, wrote textbooks on nursing including the famous Notes on Nursing. Some of her ideas are still valid today.
Florence Nightingale was a pioneer of public health and the founder of modern nursing.
Because of Florence Nightingale, nursing is one of the most regulated and respected professions in the world.
Named after her city of birth, Florence, Italy, Florence Nightingale was born on May 12, 1820, into an upper-class British family.
As a woman of her time and her class, it would have been expected that she would marry, maintain a lovely home, and be a hostess. But Florence Nightingale had very different plans. Though at the time nursing was not a respected profession, Nightingale felt very called to become a nurse.
At age 24, Nightingale defied her parents' expectations to marry a suitable match and left England to study at the Kaiserswerth Hospital in Dusseldorf, Germany.
When she returned from Germany, she took a job as a nurse at a hospital in London, and she was eventually promoted after only a year to be head of nursing there.
She improved sanitary conditions so much that she garnered a reputation as a reformer and as an advocate for public health.
During the Crimean War, the British press made public the horrendous conditions of the wounded soldiers in Turkey. The army turned to Florence Nightingale for help.
Sidney Herbert, Secretary at War, reached out directly to Nightingale. When Nightingale and her band of nurses arrived at Scutari, the hospital in the Crimea, they were shocked at what they found.
The field hospitals were positioned on cesspools of putrid water. Patients were lying in their filth. More soldiers were dying from infections than they were from wounds sustained on the battlefield.
Many of the reforms that Florence Nightingale instituted were quite revolutionary. Nightingale insisted that there be fresh air and water for all the soldiers, that recuperating soldiers receive healthy food to eat to help make them better, and that all of the bandages and sheets and blankets were adequately laundered each day.
By the time she was done, Florence Nightingale had succeeded in reducing the death rate within these military hospitals by 2/3.
Known as the Angel of the Crimea, Nightingale returned to England and received a hero's welcome, a medal from Queen Victoria, and a gift of $250,000. She devoted the rest of her life to effecting change in medical care.
In 1860, Florence Nightingale founded at St. Thomas Hospital in London the Nightingale Training School for Nurses.
She was a pioneer in the use of cutting-edge statistical methods of the time to design hospitals and medical systems to maximize the health of the community at large.
This really helped her to make her message known to the parliamentarians and government agencies who would make important decisions about hospitals and healthcare.
In her later years, Nightingale was officially honored by Germany, France, Norway, and numerous prestigious British societies. She died at her London home on August 13, 1910.
The fact that we have a nursing profession today is in large part thanks to the work of Florence Nightingale.
as Florence Nightingale's House, London, July the 30th, 1890. When I am no longer even a memory, just and vague, I hope my voice may perpetuate the great work of my life. God bless my dear old comrades of Balaclava, and bring them safe to shore. Florence Nightingale.
Need for nursing. The most important factor in hospitalization and recovery of a patient is nursing. Because it is nursing that creates an environment of care which helps to increase the speed of recovery by making the patient more comfortable. Nursing care creates a therapeutic environment, patient satisfaction, reduced hospital stay. Nursing care has to put the patient in the best position of nature to act upon him. Florence Nightingale. Nursing roles. Caregiver. Provision of care to patients that combines both the art and the science of nursing in meeting their physical, emotional, intellectual, socio-cultural, and spiritual needs. Comforter. Care for patient as a human being in a role that is traditional to nursing. Care is directed to the whole person, and not just a body part, with demonstration of care and concern. Rehabilitator. Assist patient to return to optimal level of functioning and lifestyle. Help patient to adapt physically and emotionally to changes. Communicator. Role central to all other roles. Without clear, concise and efficient communication, difficult to render effective care.
Florence
Involves
Nightingale was a
communication
pioneer of
with
public health and
patient,
the founder of
family, doctors, hospital team and community. The use of interpersonal and therapeutic communication skills to establish and maintain helping relationships with patients of all ages in a wide variety of healthcare settings. Patient advocate. Protect the patient's human and legal rights, providing information to facilitate decision-making, enforce patient rights and securing care, speaking for and on behalf of the patient. Counselor. To provide information, make appropriate referrals, facilitate patient and family problem-solving and decision-making issues. Teacher educator. Explains concepts and facts about health, demonstrates procedures, reinforces learning, determines understanding and evaluates progress of learning, assess, implement, evaluate, meet learning needs of patient and family. Leader. Assertive and self-confident provision of care in effecting change in groups. Researcher. Participate in research to enhance patient care outcomes. Other roles. Manager, coordinator, collaborator, nursing education, major, B.SC, master's, doctorate, GNM, other, certificate, diploma, in-service, nursing pre-requirements, must be licensed by the Nursing Council, must be physically and mentally fit, duties and functions.
Nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups and communities, sick or well, and in all settings. Nursing includes promotion of health, prevention of illness, and the care of the ill, disabled and dying people. Advocacy, promotion of a safe environment, research, participation in shaping health policy and in patient and health systems management, and education are also key nursing roles. Nursing staff. Nursing super. Senior nurses. Junior nurses. Trainee nurses. Sisters. Staff nurse. GNM nurses. B.SC nurses. AWAM nurses. Private nurses. IAS. OT nurses. OP nurses. Ward nurses. ICU nurses. Nursing process. Assessment. Diagnosis. Planning. Implementation. Evaluation.
If you enjoyed this video, please hit the like and subscribe button. Stay subscribed for more videos like this one.